Madam President, I come to the floor today, like so many of my colleagues, during what is undoubtedly the worst crisis that I have seen in my lifetime. It reminds me of hearing from my parents and grandparents about what it was like in America during the Depression and during World War II. And this crisis, in some ways, is even worse because it's an enemy we can't see, the novel coronavirus, or COVID-19. Not since the 1918 outbreak of the Spanish influenza has a pandemic posed such an immense threat to the public health of our country. As of this morning, more than 47,000 Americans have been tested, and they have tested positive for COVID-19. We have actually tested more than that. That's the number who have tested positive. 593 Americans have unfortunately died from this disease. And just yesterday, health officials reported more than 100 Americans lost their lives in a single day. I know that everyone in this chamber is thinking of those families and those people who have been lost due to this disease. Sadly, no one's immune. Everyone's affected, including in my home state of New Hampshire. We've had more than 100 Granite Staters who have fallen ill from the coronavirus, and sadly, just in the last few days, one person has died. My heart goes out to these families, to the family of the person that we've lost. This virus hasn't only threatened the public health of the nation, but it threatens our economy as well. Millions of Americans have been asked to stay in their homes. Schools and businesses have been closed. And while we all understand that this is a necessary step to help curb the spread of the disease, it is taking a huge toll on our workers, on our families, and on our economy as a whole. The aftermath of this nationwide emergency could leave tens of millions of families without work or steady income. I've been working closely with my colleagues here in Congress, with the rest of the delegation from New Hampshire, with our governor, to try and think about what we should come up with, what kind of package would help those people who are hurting. And during the past couple of weeks, I've had many phone calls with mayors, with public health officials, with small business owners and social service agencies, all of those people who are on the front lines of this crisis. I've heard from nonprofit organizations who provide vital services to those with disabilities, to our seniors, to veterans, and to those in recovery from substance use disorders. Because even as we're grappling with the impact of this coronavirus, New Hampshire is still, sadly, in the midst of a persistent substance misuse epidemic. Thanks to the tireless efforts of advocates, providers, policymakers, and so many in our state, we've made strides toward curbing the substance misuse crisis. We're ensuring that resources are there so that people can get the care they need. Because even though we're facing a pandemic, substance misuse doesn't take a day off. But organizations that provide essential treatment and counseling for Granite Staters are also dealing with decreased capacity and revenue shortfalls that threaten their ability to continue to be a resource for their communities over the long term. Our critical frontline healthcare providers, as well as first responders, police, firefighters, and EMTs, who are on the front lines of responding to and treating coronavirus cases, are lacking medical resources and personal protective equipment that is so necessary to do their jobs at this critical time. And we're hearing from hospitals who are facing an uncertain financial future due to the crisis. All of these troubling situations point to the need for immediate relief so that organizations and agencies that Granite Staters rely on can continue to be there. I agree with my colleagues that have come to the floor over the last 2 days to say that Congress must act. We must act to provide relief so that so many Americans who are suffering can get the help that they desperately need. In the past 2 weeks, Congress has taken several steps to provide immediate immediate help to those families who are affected by the coronavirus. These include emergency paid sick leave to many workers who get infected with the virus, who have had to self-quarantine, or who need to take care of a family members. We've provided emergency measures to ensure that every American, including those without insurance, are able to have their coronavirus testing costs fully covered. And we've expanded unemployment insurance for those who are laid off as a result of the virus. But we can and we must do more. Congress must work to address the economic devastation that so many are facing because of this virus. Just yesterday, we heard from a senior Federal Reserve official who warned that the U.S. unemployment rate could skyrocket because of this pandemic. And we're seeing that. I know all of us are seeing that in our states. At home in New Hampshire, we've had thousands apply for unemployment insurance because they've been laid off in the last few weeks. The message from the front lines is we need help and we need it fast, and Congress must provide that help. Help for our hospitals and healthcare providers and first responders as they prepare for a surge in demand for treatment as this virus spreads. We want to make sure that they have the medical equipment, the supplies they need to keep them safe while they're treating so many people who are ill. We need financial relief and paid leave to workers, especially to hourly workers and those who've been laid off because of the impact of this virus. And we need support for small businesses. Small businesses are the lifeblood of New Hampshire's economy. We've got to make sure they stay afloat, that they pay their workers while they're closed or have reduced demand. And we need to provide child care and elder care for healthcare workers, especially those who are being asked to work extra shifts. We need assistance so that Americans can afford their healthcare treatment. That's what I'm fighting for. And we're making significant progress. We've seen movement in the last couple of days. I want to call out my colleagues, Senators Rubio and Cardin, Chair and Ranking Member of the Small Business Committee, and Senator Collins. The four of us have worked together on small business provisions that are in this bill. Work continued through the weekend and late into the night last night to reach agreement on these provisions, and we're almost there. I'm confident that in the end we'll be able to deliver a package of well-thought-out provisions that will provide over $350 billion in assistance for small businesses and nonprofit organizations in New Hampshire and throughout the country. This bipartisan package will provide immediate cash flow assistance so that small businesses can continue to pay their employees, make their rent, pay their mortgage, and pay their utility bills. The bill will also provide support to small business development centers, to women's business centers, to veterans business outreach centers, all those resource agencies that can help small businesses as they're trying to figure out how to navigate this crisis and how to get the help they need. We're also providing 6 months of relief for existing SBA borrowers. And of course, to make this work, we need all those lending institutions, our banks and our financial institutions. They're already on the front lines of trying to help small business, and they are going to be critical to making this package work. But there is much more to be done. We still need to provide funding for state and local governments because as we speak, tax revenues are plummeting, the cost of responding to this crisis are skyrocketing, and I've heard from so many municipal officials who are on the front lines, who are spending money, who are not sure how they're going to replace those dollars as they respond to this crisis. We need additional funding for hospitals because they're going to see a terrifying surge in patients in the coming days and weeks. They're going to have to make very difficult decisions about the kind of care they're able to provide, and we need to make sure they have the resources they need. We need to make sure that big corporations continue to support their workers through this crisis. And we need legislation to ensure that New Hampshire's nonprofits and social service organizations, like those in the rest of the country, who are in dire financial straits, can continue to receive assistance because their services are needed now more than ever. And once we get through the worst of this crisis, we're going to need those organizations to be able to continue to serve people in our communities. I think I and most of my colleagues here are working in a bipartisan way and with this administration to find common ground and to address the needs of the nation. I've been disappointed at some of the partisan attacks on the floor of the Senate, because I think everybody's goal is the same. It is to respond to the needs of this nation, to make it clear to people who are our constituents and people across this country that we are here to try and address the suffering that they're experiencing. Madam President, our country's hurting right now. People are looking to this body for leadership. That's why it's so important that we get this bill right. This is one of those times in history when Congress must set aside any political differences, where we must deliver a bill that meets the challenges we face. Because at the end of the day, we are all in this together.